Hello friends, now I would like to start a new chapter right now, which is aphakia. In a previous class we have learned about myopia. So right now we are going to learn about aphakia. What does the word aphakia means? Aphakia generally means absence of crystalline lens. If there is no crystalline lens, then that condition is called as aphakia. So considering it, here the lens is completely absent. So due to the absence of lens, this aphakia may lead to high degree hypermetropia. The consequence of aphakia is high degree hypermetropia. As we have already discussed, for hypermetropia the degrees can be mild, moderate and severe. Here it leads to high degree of hypermetropia, this aphakia. Right? What are the causes of aphakia? Why is the lens absent? The major cause may be congenital absence of lens, but this may be a rare condition. And the second one may be surgical aphakia, that is, due to some other surgery the lens has been removed, and this is the most common condition. The third type is if the lens is completely absorbed by something, that is absorption of lens matter. Even this may lead to aphakia, right? That is, this lens matter is absorbed by some phagocytes, or it is destroyed in one way or the other in the body, then this may lead to aphakia. Or it may be traumatic, some injury to the eye leading to lens extrusion, traumatic extrusion of lens, though it is a rare condition. Next, posterior dislocation of lens. This is also one of the good condition, that is, the lens is dislocated to the posterior side, leading to aphakia, posterior dislocation of lens, right? So all these are the causes of aphakia. What are they? Congenital absence of lens, or surgical aphakia, that is due to some surgeries leading to removal of lens, or traumatic extrusion, or posterior dislocation of lens. So what are the optics of aphakic eye? So what happens if there is aphakia? As I have already mentioned, there is hypermetropia, then power of eye is decreased to plus 44 diopters. Normal power of eye is plus 60 diopters, so it is decreased to plus 44 diopters. And the second thing is anterior focal point it becomes 23.2 millimeters. But what is normal in both the cases? If in power of eye, plus 60 diopters is normal. Similarly, in anterior focal point distance is 15.7 millimeters. It is common. What is this anterior focal point? If this is the lens, this is the cornea, these are the lens. So this distance, right? So this distance is it becomes 23.2 millimeters in front of cornea. I'm sorry, it is not this distance. Anterior focal point of lens. Just a minute. So here anterior focal point, this is not the diagram. So this is the cornea. there is a focal point which is anterior focal point, which is generally 15.7 millimeters in length, but here it becomes 23.3 millimeters from cornea in aphakia. Okay, there is also posterior focal point which is behind the cornea, something here, right? This posterior focal point is about 31 millimeters behind the cornea, right? So coming to the next, what is it? Posterior focal point. This posterior focal point is generally 31 millimeters in aphakia, but normally it is just 24 millimeters. So even the anterior and posterior focal points have been increased. So now we're coming to the next sign, which is accommodation is completely lost. That is, there is no accommodation we see in aphakia because of absence of lens, right? Adjustment of ciliary muscles and the lens adjustment results in accommodation. But here, due to the absence of those, there is no accommodation. Then clinical features. 1. Defective vision. Which type of defective vision do you think it is? See, there is both far and near defective vision, far and near, and there is high degree of hypermetropia, as we have already discussed. The second thing is erythropsia and cyanopsia. What does this mean? Erythropsia and cyanopsia. This means that one person would be able to see both red and blue images. Red is erythropsia and cyanopsia is blue images. A person would be able to see these red and blue images. Why? The reason is because of no lens. So this lens cannot focus only the light rays to fall, that is the visible light. So along with visible light, there is entry of ultraviolet rays and infrared rays. And this entry of ultraviolet rays and infrared rays, this leads to red and blue images which are seen. And such a condition is called as erythropsia or cyanopsia. Now coming to the signs of lens. 1. What are the major signs which you see in? So here the signs which you see in aphakia are generally 1. Jet black pupil. If you see the pupil here, it is jet black in color. This is the most characteristic feature which you can see in aphakia, which is jet black pupil, right? And the second one is, if you see here, this is the anterior chamber. The anterior chamber looks deeper. Why? Because of absence of lens, right? Because of absence of lens, the anterior chamber looks deeper, right? So that is, these both are the major characteristics. Now next, you can also see iridododensis. This iridododensis here, what does iridododensis mean? Iridododensis is movement of iris. That is movement of the part of eye. It is vibratory movement. It is iridododensis, which is vibration or agitated movement of iris with eye movement. That is, the iris which is present, it moves as the eye moves. So what it generally means is, once the eye moves, movement of eyes, this leads to movement of iris, which you can see. That is vibratory movement of iris which can be seen outside, right? That is iridododensis, which is the characteristic feature of aphakia. But why does this movement of iris occurs? This is because once the lens is not there here, the major stabilizing part is lost, right? The lens is connected to ciliary muscle, ciliary body, iris, all this works as a unit. So once the lens has been removed or lens is lost by one or the other way, then the stability of this unit is lost. This loss of stability results in the vibratory motion which you can see outside as the eye moves. This movement is called as iridododensis. Now how do you find it, right? How do you demonstrate it? It can be demonstrated by Purkinje image test, because in this image test, as I have already mentioned, in aphakia we can see ultraviolet radiation and infrared radiation. So there is cyanopsia and erythropsia. So this cyanopsia and erythropsia can be found by this Purkinje image test. Next, on fundus examination, what can you see on fundus examination? You can see hypermetropic small disc. You can see on fundus examination, you can see small disc. Optic disc is small, which is again hypermetropic, right? Next, you can even do retinoscopy. And autorefractometry. Both these also reveal that it is a high hypermetropia. Now, what are the treatment of aphakia? One, optical treatment, that is to correct refractive error by convex lens, which is used for hypermetropic patients, right, with appropriate power. And the modalities, how do you correct, how do you modes? The modes include, there may be spectacles can be used, lens can be used, that is contact lenses can be used, or you can also use what do we say, those intraocular lenses, that is intraocular implantation by surgery can be done. Intraocular implantation by surgery can be done. And then we can also do refractive corneal surgery. Refractive corneal surgery can also be done. All these are the modalities of treatment. If you see spectacles are one of the best way and most commonly employed way for correcting this aphakia. So we generally used to use spectacles, but right now the use of spectacles has decreased. In already emmetropic patients, 10 diopter cylindrical lenses are generally used, plus 10 diopters, that is cylindrical lenses, are generally used for spectacles. To induce, but do you know the use of cylindrical lenses is generally not used for hypermetropia, but if surgery, and here it is generally used if there is induced astigmatism, which we will discuss in our later classes. Only and only if there is induced astigmatism, then these lenses are used, that is cylindrical lenses plus 10 diopters are used, but presently the use has been decreased a lot. So now we generally, then what do we generally use? We generally use either intraocular lens implantation, which is the best way for using it. The best way for using it is intraocular lens implantation. Okay, the best way which is used is intraocular implantation, which is the best way. So let's deal with each of them in detail, it would be better. So I would take a fresh paper here. So let us discuss each modality of treatment in the best possible way. So first, using spectacles. So spectacles is used once upon a time, but now use is decreased, and it is generally used to correct astigmatism, which is generally induced due to this aphakic surgery. Reason why is it induced is due to surgery. This induced astigmatism, to correct this induced astigmatism, we generally use spectacles, right? So what are the disadvantages of spectacles? The disadvantages of spectacles are mainly because the field of vision is limited. Vision is limited because in lens the field of vision is complete. Here the field of vision is a little limited. The other disadvantage is roving ring phenomena. What is roving ring phenomena, or roving ring, to say instead of phenomena, scotoma? This is also called as jack in box phenomena, right? This is also called as jack in. So for knowing this jack in box phenomenon or roving ring scotoma, let me draw a small diagram. Just imagine this is the eye and here there are lens, right? So the rays of lens come and fall like this, they fall like this, they fall like this, but those rays which are a little away, see these rays, this part of rays and these part of rays, these rays cannot pass through this, cannot pass through this spectacles or lens which we use outside. So these rays produce a prismatic effect, which is called as roving ring scotoma, right? This mainly occurs due to the rays which cannot fall with the spectacles. If this is the lens of the spectacles, those rays which cannot pass through the lens of the spectacles, there we see this roving ring phenomenon. And the one other disadvantage is some cosmetic purposes, and it is also, even if the image is magnified by 30%, even then this is not useful for aphakia, because here the image is magnified mostly about 30% but not more than that. So because of that, this is not useful for aphakia, not used for aphakia, right? It's coming to contact lenses. The second use is contact lenses. These are more used, right? So what is the main use of contact lenses? This is because less magnification of image, Here if you see spectacles, there is more magnification of image. Here there is less magnification of image, which is good and suitable. And there is decreased prismatic effect, that is rowing ring phenomenon, due to those rays which cannot pass through the spectacles. But here lens are worn very close to our eyes, so this prismatic effect is decreased. And there is better field of vision. There is no restriction to field of vision as we have seen in spectacles. Here there is better field of vision and it is cosmetically acceptable, and so this is best for aphakia. Best for that to uniocular aphakia. If you see aphakia, right? So these are about the contact lenses. And the third one is intraocular lens implantation. This intraocular lens implantation is a better way when compared to the other ways. So it is, to say it is the best available way, this is done through a surgery, and this is the best employed way for the aphakia when compared to the above two, which are the use of spectacles and the contact lenses. And the fourth one is refractive corneal surgery. What are the refractive corneal surgeries include? In refractive corneal surgery, one is keratophakia, right? Keratophakia. What does this keratophakia mean? The keratophakia is a lenticule is prepared from the cornea in these both conditions. We prepare the lens or lenticule from cornea, donor cornea, but the position differs. There is keratophakia and also there is epikeratophakia. In keratophakia, lenticule is from donor cornea. That's true, in both it is from donor cornea, but in keratophakia, lenticule from donor cornea, this is placed between lamellae of patient's cornea. It's like, if you see this, I'll draw two diagrams for these both, keratophakia and epikeratophakia. If this is the cornea, these are the lamellae. I'm just magnifying it to see, these are the layers of the cornea, many layers, right? So the lenticule is placed here in keratophakia. So this is the lenticule which is placed in keratophakia. This is lenticule. It is between lamellae, right, of cornea. And what about epikeratophakia? In epikeratophakia, this is the lens. So here lenticule is placed over the surface of cornea. So here in epikeratophakia, this is lenticule over surface of cornea, right? So these are the different. And the second type of surgery which can be used is hyperopic LASIK or laser therapy, which is used. right? So all these are the conditions which are, all these are the modalities of treatment for aphakia. One is use of spectacles, which is a better way, and the other is use of contact lenses. Next, use of intraocular lens implantation, and we can also use refractive corneal surgery. In that we can do either keratophakia or epikeratophakia or hyperopic LASIK, that is laser therapy, which is really very common nowadays. So all these are the major things for aphakia. If there are any mistakes, please try to rectify me.